Hello, my name is Joanna Cohn, and on behalf of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health, I am delighted to introduce our Innovations in Tobacco Control speaker, Dr. Qinghua Nian. Qinghua is IGTC's country lead and partner liaison for all matters related to China. She also leads and supports quantitative data management and analysis, complex study designs, and the writing of fact sheets, reports, abstracts, and manuscripts. Prior to joining IGTC, Qinghua worked at Miami University as a senior statistician and data specialist, where she led and oversaw research design, collection, and analyses of quantitative data, and preparation of reports for a variety of state and federally funded projects. Qinghua received her doctoral degree in urban affairs and public policy and her master's in economics from the University of Delaware. She has been with IGTC for almost 5 years now. She has 19 peer-reviewed publications with 12 as first author, and her expertise is in high demand. In just the past 2 years, she was invited to review 17 manuscripts submitted to scientific journals. So today, Qinghua will be sharing some of her work to advance tobacco control in China. Qinghua, welcome, and over to you.
Thank you very much, Joanna. Yeah, let's get started. Hi, thank you everyone to come today. It's a pleasure to be here today to discuss an important and involving topic, advancing tobacco control in China. I will introduce several studies conducted in China by Institute for Global Tobacco Control that provides insights into the progress, challenges, and future directions of tobacco control efforts in China. I have no conflicts of interest related to this presentation, and all studies discussed today were funded by Bloomberg Philanthropies. First, I'd like to briefly discuss why tobacco control in China is a critical and important topic. Globally, 22% of the population uses tobacco, while global smoking prevalence has declined over the past 20 years. Population growth has kept the total number of people who smoke remains very high. Over 1 billion people who use tobacco live in low and middle income countries. In China, more than 1 in 4 adults smoke, with smoking rates reaching nearly 50% among men, making the country a key focus of tobacco control efforts. In China, we face unique challenges because the country is not only the largest consumer of tobacco in the world, it is also its largest producer. More than 2.3 trillion cigarettes are manufactured in China every year, and approximately 1 in every 3 cigarettes smoked globally are consumed in China. Tobacco use remains a leading cause of preventable death worldwide. Every year, over 8 million people die from tobacco-related diseases globally, including more than 1 million deaths in China alone. While the prevalence of smoking and e-cigarette use among secondary school students may not appear very high, it still represents a substantial number of young people at risk of nicotine addiction in China. Additionally, over 80% of students who attempted to purchase cigarettes were able to do so without being refused. Nearly half of students were exposed to tobacco marketing at retailers. The photo on the left shows a retailer near a school, where cigarettes were displayed very close to candies and snacks. This type of placement increases youth exposure to tobacco products and may contribute to normalizing smoking behaviors among students. China has implemented several regulations aimed to prevent youth tobacco and e-cigarette use. The law on the protection of minors prohibits the sale of tobacco and e-cigarettes to minors and bans tobacco and e-cigarette sales near educational facilities. However, enforcement remains a challenge. The 2022 e-cigarette regulations ban non-tobacco flavored e-cigarettes, reducing their appeal to young people and discouraging both experimental and long-term use. The Empower framework was introduced by the WHO Framework Convention on Tobacco Control, IGTC, to support global tobacco control efforts. China ratified the WHO IGTC in 2005 and has made some progress, but there are still some gaps. For example, while some local governments have enacted smoke-free laws, there is no national comprehensive smoke-free law. Only 14% of the population is covered by 100% smoke-free policies. There is limited access to cessation services, and smoking cessation support is not widely available. Slightly over 1/3 of adults are aware of the increased risks of diseases due to smoking. This highlights the need for stronger health warnings. Tobacco advertising and promotion bans exist in public places, but the tobacco industry continues to market through product displays, internet ads, and corporate donations. Another thing is about tobacco taxes. They were raised in 2009 and 2015, increasing the prices by 11% on average, but the cigarettes remain affordable because the inflation was not being offset. Industry interference remains a major barrier to advancing tobacco control in China. China's tobacco industry is state-owned, with two key entities: the State Tobacco Monopoly Administration, STMA, that acts as the regulator, playing a central role in FCTC implementation in China. The other is the China National Tobacco Corporation, CNTC, that operates as the business entity, controlling tobacco production, distribution, and sales. Both organizations are part of the Chinese government. Tobacco regulation and industry operations are not separate, leading to conflicts of interest. STMA heavily influences tobacco control policies, often favoring economic over public health interests. Understanding policy priorities helps position tobacco control as a national issue rather than just a public health concern. China's current policy priorities are shaped by economic growth, minors' protection, increasing birth rates, and sustainability goals. Tobacco control policies are more likely to gain political support when framed within China's national development strategies. Next, I will introduce several tobacco control studies conducted by IGTC in China in recent years and discuss how their findings inform policy changes and strengthen tobacco control efforts. The Institute for Global Tobacco Control, IGTC, is part of the Johns Hopkins Bloomberg School of Public Health. Our work is grounded in scientific research, supporting tobacco control interventions and capacity building to prevent death and disease from tobacco products worldwide. IGTC have been actively engaged in tobacco control research in China for several years. This timeline highlights some studies conducted between 2017 and 2024. In the following slides, I will provide more details on these studies and their policy implications. The first study I will introduce is the health warning labels study conducted in 2017. Health warning labels on cigarette packages are a highly cost-effective tobacco control measure. They communicate information about the health risks of cigarettes, cause people who smoke to think more about the health harms of using cigarettes, and prevent people who don't smoke from smoking initiation. After ratifying the WHO FCTC in 2005, China has made modest efforts to enhance its health warning labels. This slide illustrates how health warning labels have evolved over time in China. Current health warning labels show on the pack show on the rightmost image cover 35% of the front and back of the pack, but remain text only, which are still fall behind the FCTC best practices. The latest Chinese labels are still without information on specific smoking-related diseases and provide no useful information on how to access support for cessation. This study aimed to design health warning label themes tailored to China's culture, values, and public health goals. It also examined the effectiveness of designed health warning label themes and the potential association between weaving the designed themes and the intention to quit smoking. A cross-sectional randomized experimental survey was conducted in 3 major cities, Beijing, Shanghai, and Shenzhen. These cities were selected based on their economic development, population level, and existing tobacco control policies. All 3 cities have implemented a comprehensive smoke-free law. Participants were recruited using quotas based on age, gender, and smoking status. We designed 4 health warning label themes for this study, including self-harm from using cigarettes, harming family or children with secondhand smoke, reinforcing compliance with smoke-free policies, and anti-cigarette gift-giving practices. To better understand the theme design, we can break it down into different components displayed on the pack. The key components from top to bottom are a primary message, a secondary message, a warning label image, and a quit message. The primary message intended to inform participants about the health risks of smoking and the dangers of secondhand smoke to others. The secondary message reinforced these points by highlighting health consequences and providing motivational message to encourage quitting. You can also find the branding in this design was placed at the bottom of the pack. A total of 3,231 adults were eligible to participate in this study. They were randomly assigned to one of the 4 themes. Before reading the health warning label theme, participants answered pre-reading questions, including their intention to quit smoking among those who smoked, and they were then shown 8 health warning labels from the theme they were assigned to. After weaving, they responded to post-weaving questions, assessing the effectiveness of the health warning label theme and quitting intention. There are some key findings. Effectiveness of the theme was measured on a 1 to 10 scale, 1 being not at all, and 10 being extremely effective. Participants rated the theme based on the impact on credibility, prevention of smoking, concern about smoking near family members and children, likelihood of complying with public smoking bans, and encouragement to think about quitting. We found all 4 themes performed well. Harming family or children with secondhand smoke theme, as shown on the right of the slide. This theme received the highest ratings. This theme showed significantly higher credibility and prevention of smoking outcomes compared to other themes. Effectiveness ratings remain constant across gender, income, and educational levels. When comparing the pre and post-weaving responses, we observed about 15% fewer participants who smoked reported that they had no plans to quit smoking after weaving the health warning label theme. This statistically significant improvement was found both overall and within each theme group. And the shift in quitting intention was observed across different social demographic groups. This is the first study in China to examine the effectiveness of health warning label themes designed to reflect China's specific values and health goals. It also assessed how these themes influence the intention to quit among people who smoke. The findings provide evidence-based support for the Chinese government to design a series of health warning labels that aligns with global best practices and address unique cultural factors and tobacco control challenges in China. Those graphic health warning label themes can help reduce communication inequity across different social demographic subgroups by providing clear, impactful messaging that transcends literacy barriers. Stronger graphic health warning labels can increase public concern about smoking near family and children, reinforcing social norms that discouraging smoking. The shift in attitudes may lead to behavioral changes, such as reduced secondhand smoke exposure and a decline in smoking prevalence. Next, I'd like to introduce the tobacco pack surveillance system, the TPACs, in China. The photo on the right was taken last year at an event where we showcased all the cigarette and e-cigarette packs collected in China in 2023. The TPACs project systematically documents the variety of tobacco and nicotine products in several low and middle income countries, including China. It also monitors the implementation and the compliance of health warning labels and tracks pack design features and appeals that helps inform stronger packaging regulations. TPACs has conducted 3 waves of pack collection in China, with the most recent wave in 2023. Unlike previous waves, the 2023 study expanded its scope to include e-cigarette packs in addition to cigarette packs, reflecting the growing market for nicotine products in China. Packs were collected from 6 cities: Beijing, Shanghai, Chongqing, Guangzhou, Kunming, and Shenzhen. The selection was based on several key factors. Shanghai was chosen as China's most populated city. The other 5 cities were selected for their geographic diversity and varying smoking and e-cigarette use prevalence, ensuring a comprehensive representation of the tobacco product market across China. Vendor types were selected based on Euromonitor data, ensuring that the study covered popular retail outlets for tobacco and nicotine products in China. 4 vendor types for cigarette pack collection were independent small grocer, tobacco specialty, supermarket, and hypermarket. E-cigarette packs were collected from vape stores. Packs and pack photos collected by T-Packs provide a valuable data source for assessing health warning label compliance and supporting studies on design features and marketing appeals. The photos on this slide showcase examples of cigarette and e-cigarette packs collected in 2023. Some general pack information visible on these packs are the brand names, manufacturers, and the price information. For assessment of health warning label compliance on cigarette packaging, T-Packs data allow for the examination of mandated warning presence, placement, size, and text to background contrast. IGTC's prior studies suggest that over 90% of cigarette packs in China with mandated health warning label messages comply with the regulation. However, as shown on the 3 pack photos on this slide, you can see some branding and design elements that may reduce health warning label effectiveness, making the warnings less prominent compared to global best practices. By examining the packs collected in 2023, we found approximately 90% featured colors or patterns extending into the health warning label area, blending the warning into the overall pack design. And about 1 in 4 packs included branding elements directly below the health warning label, potentially drawing attention away from the warning message. Cigarette pack design in China often incorporates culturally significant elements that may influence consumer perceptions and appeal. These elements can create associations with tradition, national pride, health, and nature. As shown on this slide, the packs featured rare animals such as dragons and pandas, or traditional herbs such as ginseng. These features make tobacco products appear more desirable or less harmful, and may potentially undermine the impact of health warning labels. This slide highlights how cigarette packaging in China incorporates wedding-related themes, using symbols and imagery commonly associated with marriage and happiness, such as double happiness symbol, pair of magpies imagery. These design elements may enhance the appeal of tobacco products, particularly in celebratory and gift-giving contexts, reinforcing their cultural significance. Similar to cigarettes, CPAC's data can be used to assess health warning label compliance on e-cigarettes, both on packaging and products. Among 143 unique e-cigarette packs collected in 2023, we found 51 packs were clearly labeled as tobacco flavors, 58 featured concept flavors, and 35 were labeled as non-tobacco flavors. This slide shows how e-cigarette packaging in China continues to incorporate flavor descriptors and imagery despite regulations banning non-tobacco flavored e-cigarettes. The right one features an e-cigarette pack with a lemon ice flavor descriptor and lemon and drink images. Some e-cigarette packaging and product designs incorporate elements that are especially appealing to youth. One example is a disposable device collected in 2023, as shown on the left, designed to resemble a coconut latte-flavored bubble tea cup. On the right, the disposable pod pack features pixelated gaming graphics and strawberry imagery, reinforcing a fun and playful look. These design choices make e-cigarettes more attractive to young consumers and potentially increase youth appeal and experimentation. While China has made progress in regulating tobacco and nicotine product packaging, additional measures such as graphic warning labels and plain packaging could further strengthen health communication and align with the WHO SDTC recommendations. Removing brand logos, colors, and promotional elements make tobacco and nicotine products less attractive, particularly to youth. Uniform pack shape, size, and color minimize brand differentiation and reduces consumer appeal, discouraging initiation and use. So implementing these measures would help enhance public awareness of tobacco harms, reduce product attractiveness, and support stronger tobacco and nicotine product packaging regulations in China. And we move on to the next one, which is a study on tobacco and nicotine product sales and marketing near schools. The presence of tobacco retailers in school neighborhoods and exposure to tobacco marketing are associated with increased susceptibility to smoking among adolescents and a higher likelihood of early smoking initiation. Studies in urban areas of developed cities in China have found a high density of tobacco retailers near schools. So what this study adds? This is an observational study, examined tobacco retailers near middle, high, and vocational high schools in both urban and rural areas across 10 cities in China in 2021 and 2023. These cities were selected based on geographic location, population size, and economic development levels to ensure a diverse and representative sample. The study aimed to analyze changes in the number of retailers selling and marketing cigarettes and e-cigarettes near schools, providing insights into youth exposure to tobacco and nicotine products over time, and also observed the impact of the 2022 ban on non-tobacco flavored e-cigarettes. We used a multi-stage sampling approach with a simple random sampling technique to select urban districts and rural counties within each selected city, then select schools within those areas. In total, 904 schools were selected, including 452 middle schools, 316 high schools, and 136 vocational high schools. Following a working protocol, data collectors identified retailers that sold cigarettes or e-cigarettes near schools, and they used an online mapping app to record geographic coordinates of those retailers. Working in pairs, data collectors completed an online observational checklist to document cigarette and e-cigarette sales, product placement, displays, and advertising, and the display of no sales to minor signs at retailers. We observed a decline in both cigarette and e-cigarette retailers near schools over time. Although the total number of retailers decreased, cigarettes and e-cigarettes remained highly visible, with over 90% of retailers displaying these products. Furthermore, tobacco advertising became more visible, increasing both inside and outside stores. The photo on the left shows a stationery store near one of the schools in the study. Notably, cigarettes were visible outside this stationery store, and you can see white paper on the window is actually a sign indicating cigarette sales. One improvement was found regarding the compliance with no sales to minor sign, with about 2/3 of retailers displaying the sign in 2023. When using school as the analysis unit, we found a significant decrease in the proportion of urban schools and rural schools having at least one cigarette retailer nearby. The prevalence of flavored cigarette retailers around urban schools also significantly decreased. However, it remained high near rural schools. About half rural schools had at least one retailer nearby selling flavored cigarettes. Despite a decline in the overall number of retailers near schools, cigarette and flavored cigarette sales and displays remain widespread. While tobacco and nicotine product sales near schools are prohibited by the law, enforcement remains inconsistent, and national regulations do not specify a minimum distance between retailers and schools. To better protect youth in China, it is essential to strengthen enforcement of existing regulations, establish clear distance restrictions for tobacco sale near schools, implement comprehensive advertising bans, including restrictions on product displays, to minimize youth exposure to tobacco products. And it can further restrict flavored cigarettes, which may decrease the appeal of tobacco products to young consumers. The final study I'd like to discuss is the 2024 Tobacco Liter Palette Study. Tobacco consumption generates various types of waste, including discarded packaging, cigarette butts, and e-cigarette waste. The presence of branded litter can indirectly promote tobacco use by normalizing it in everyday environments. reducing tobacco litter is not only crucial for environment protection, but also supports tobacco control efforts. This is the first study on tobacco litter in China. The pilot study was conducted in Guangzhou, the capital city of Guangdong Province and a major e-cigarette manufacturing hub. The study aimed to assess tobacco litter in outdoor environments and the presence of cigarette cards. It also sought to develop and test data collection methods for future large-scale study. We selected 20 schools, including 10 elementary schools and 10 middle and high schools, along with 2 sites each from government buildings, office areas, recreational spaces, residential areas, and transportation hubs to assess tobacco litter in outdoor environments. Data collectors followed a 250-meter walking protocol and used an online data collection tool to document all observed tobacco litter. Over a 2-week data collection period, we identified a total of 39 discarded cigarette packs. All of them had visible branding. In addition to the pack litter, we observed over 2,000 cigarette butts. Branding was visible on most of them. On average, 22 cigarette butts were found per visit around schools. This is a number very close to that observed at transit hubs and higher than in other environments. This makes us feel curious about why it is happening. And data collectors' observations provide possible explanations for the high number of cigarette butts around schools. They noted that much of the litter likely came from parents and grandparents smoking while waiting at the school entrances for their children. There are some codes showing on slide. This highlights the need for the outdoor smoke-free policies near schools to reduce both tobacco waste and youth exposure to smoking behavior. This pilot didn't observe any e-cigarette litter or cigarette cards. Branded cigarette butts and pack litter were common in Guangzhou. This visibility can reinforce brand recognition and social norm around smoking, acting as a post-consumption marketing. The presence of tobacco litter near schools creates another point of exposure for youth, normalizing tobacco use. Implementing play and standardized packaging can reduce the branding effect, minimizing the marketing appeal of tobacco products. Policies requiring biodegradable packaging and eliminating cigarette filters, which is one of the most common forms of litter, can significantly reduce tobacco's environmental footprint. In this year, building on insights from the pilot study, we are expanding our investigation to assess tobacco litter around schools and across diverse outdoor environments in both urban and rural areas across 6 cities in China, including Shenyang, Jinan, Kaifeng, Baiyin, Chongqing, and Kunming. These cities were selected for their geographic diversity and varying levels of economic development. This study aligns with China's policy priorities on youth protection and environmental sustainability, and will provide evidence to inform tobacco product packaging regulations and outdoor smoke-free policies. We have conducted several tobacco control studies in China over years, but an important question remains: how can research further advance tobacco control efforts in China? I'd like to share some thoughts on strengthening tobacco control efforts in China. As researchers, framing tobacco control as a key driver of economic growth, youth protection, and sustainable development can help gain political traction and foster multi-sectoral support. Beyond generating evidence, it is also crucial to engage multiple sectors, including health, environment, economy, and education, to build cross-sectoral collaboration that drive meaningful policy change. Another important consideration is effectively translating research into actionable policy recommendations. This involves developing policy briefs and data-driven insights tailored for decision makers, ensuring that tobacco control policies are grounded in rigorous evidence and aligned with China's broader policy priorities. To conclude, I'd like to share some key publications related to the studies I introduced today. You can scan the QR code to get access to the list of populations, and you can also find more global control publications on the IGTC website. We will have time for Q&A, but if you have further questions and hope to contact me directly, feel free to reach out to me via email. Thank you.
Qinghua, that was fantastic. Thank you so much. You gave us such a broad overview of different kinds of work, starting with very specific messages and pictures on health warning labels, then moving into packaging issues, talking about the point of sale and the display and advertising of products at the point of sale over 2 points in time, and then also sharing some newer work around tobacco litter. So all very interesting. Thank you so much. For folks online, please put your questions in the chat, and maybe I'll just start with one question, and I see the questions coming in. You know, I had an assumption, which was wrong, that because the tobacco industry in China was a monopoly, that the packages would be very boring. But that is simply incorrect. And you showed us some beautiful packages, and I'm sure that's just like a small fraction of, you showed us a picture of all the packs laid out on tables. Do you want to just say, these are some of the most beautiful packs in the world that I've seen. Do you have any comments about that?
Yeah, I agree, Tate. I agree, but it's also very annoying. Fact is, the packs from China probably is the most appealing packs around all over the world, and it's interesting is the regulations in China. They have very general rules about what could be put on the packaging, that they don't have like very specific rules, like say what should not be put there. And CNTC have some local manufacturers as well, like the Shanghai tobacco or like Yunnan province tobacco. And they also have their authority to design the pack as they want. and they normally will add some culture or local features there to make it more beautiful and may attract people in their own areas, even like to attract new consumers like youth or even women. So it is beautiful and at the same time very worrisome.
That's fair. Okay, great. So we have a couple questions on clarifications of the existing sort of policy environment in China. So the first question is about, well, I guess it's partly related to your point of sale study. So you talked about availability of tobacco products near schools in China in a number of cities. And the question is asking about online sales and marketing online. And the question is like, do you have a sense, I don't, of how much of an issue that is?
Uh, I don't have like solid data to support my statement, but based on my observation, clearly online sales is a big issue in China, especially for the nicotine products, which I mean here is e-cigarette products. From our study, we observed the retailers around schools, and we didn't find lots of e-cigarette retailers there. However, there may be a serious issue online sale, e-cigarette sale in China. Um, our colleagues, and Joanna, you know this very well, our colleagues like Jenny and Toyan has conducted studies about like the e-cigarette marketing online, and they have found very interesting facts. And I'm also personally very interested in this area. Yes, people, if you are interested in learning more about that, you can may check the IGTC website. You can learn more. But based on my own observation, I think yes, online sale is a concern for sure.
Thank you. That might be a topic of a future
Yeah.
innovations lecture. So this is another clarification about the policy environment in China. You did um, talk about litter around schools in the pilot study. And the question is whether in China there are restrictions on smoking outside of educational institutions.
Unfortunately, we don't have, I think China don't have that, at least not don't have that at national level. Some schools may have their own policies, but they have the policy like no smoking in schools. But if it's outside schools, like beside the school entrances, there's currently there's no law to ban the smoking like outside schools.
We have someone from Nepal sharing the wonderful news that Nepal has passed 100% health warning, pictorial health warnings.
Mm.
They're already at, I think, 95% already super high, but even going further. So
Mm.
congratulations to Nepal and all the folks who worked hard there. Um, so they're saying that they are facing some challenges with implementation. And you talked about maybe in China, they are adhering to the letter of the law, but not the spirit of the law. So maybe can you talk a bit more about challenges around implementation of health warning labels?
Yeah, there are a few challenges. First, congratulations, Nepal. It's a big victory, I think, for tobacco control people. But there are clearly many challenges, and we are talking about the industry interference at the beginning of this lecture. And we know that STMA, the State Tobacco Monopoly Administration, is the entity that actually also the regulator for FCTC implementations in China. And we the tobacco control people clearly face a lot of challenges from them. Like they don't want to accept the pictorial, like graphic health warning labels because the argument is it's not good for the culture. Chinese people will never accept it, but it's clearly not true because we can see these health warning labels, graphic health warning labels, has been implemented in Hong Kong, in Taiwan, and in Singapore. So there clearly are lots of challenges. The first thing is how we can advance that graphic health warning labels in China. And the other thing is the current health warning label regulations. They have some general rules, but they are now like very specific enough. Like when for the TPEX slides, when I'm showing like various designs, they are so beautiful, and they have like the consistent patterns and the colors in the health warning label areas and the whole pack, like make it like very consistent design and the beautiful brandings around health warning labels. These are not banned in China. So it's now like haven't been written in the law, like say, okay, health warning label need to be prominent and we should not allow any branding around it, or the color should differentiate from the whole pack design. So there are a few things I think researchers and also in-country tobacco control and public health people advocacy can do to keep providing evidence and to advocate for the health warning label regulation change in China.
Lovely, thank you. That's helpful. We have another great question. This is about, and we'll see it. You can choose how you answer this, but it's a question about aligning tobacco control efforts in China to broader development objectives, which you did mention early in your presentation, the current policy priorities of the country. And so I guess the question is, what is the level of effort to link tobacco control as a key measure to help achieve these objectives, including reducing NCD burden, not the burden of non-communicable diseases, and the health system financial sustainability, as China is not a country that can afford to treat their way out of a rapidly aging population that is afflicted with chronic diseases. So efforts of aligning the tobacco control objectives to the broader development objectives.
Yeah, this is a great question. I'll try my best to share some thoughts about how to align this. It is challenging, especially post-COVID era, let's say that, because the economic slowdown has increased the government's reliance on tobacco tax revenues in China. And the tobacco industry can make that argument, say, okay, we are supporting that. But my thought is, so clearly there's some burdens induced by tobacco use, and it can influence the medical cost of the country, and also the workforce They also influence workforce productivity. And as mentioned, it's about the aging things and other things, other health concerns. I assume the researchers could conduct studies related to these, how the positive economic impact the tobacco control efforts can provide to the country. And that is not just cost country money to support cessation or something, but it's actually, if you got a healthier populations, it's actually reduce your health cost, is actually make your children healthy, and even like increase the birth rates. So I feel like we can work on that perspective and to promote the tobacco control ideas to the policymakers. That's some thoughts. But again, thank you for the great questions.
Thank you, Qinghua. So we just have a couple of minutes. Let me ask you, try and combine two questions. So I'll give you two parts. So first of all, just a quick one. Do you know of any longitudinal study of tobacco use in China? And second,
Um,
and this is a bit different, one of the participants said they are seeing, when they've been in parts of China, they see a lot of smoking outdoors, and wants to know, is there any work that you and IGTC are doing to address enforcement of smoke-free policies?
Yeah, thank you. So for the first question about the longitudinal study for tobacco use, I believe China CDC worked together with WHO to conduct adults and adolescents and youth tobacco use survey um, for a few years. Um, and so this is the one I can I see before. For the next question is about the outdoor uh, smoking issue. For that one, yes, we haven't done a lot about smoke-free in outdoor spaces. We have worked together with the vital strategies regarding smoke-free in indoor places. That is a compliance study when Qingdao has implemented its 100% smoke-free policies, and we conduct a compliance study there, but it's all about indoor public places. For the outdoor, it's one thing I shared is our latest study from the outdoor smoking near school entrances. And this, we are now conducting a follow-up large-scale study about tobacco litter, and we also observe the outdoor smoking near schools. So that may provide some evidence to support the outdoor smoke-free policy change in China.
Thank you. And there's still like some excellent questions in the Q&A, but unfortunately we're out of time today. So Chinghua, thank you so much for sharing your work in a number of policy domains around tobacco control in China, providing the larger context as well for all of us, and wish good luck with what comes next, and particularly with the larger litter study that is going to be started. And we look forward to hearing those results. Thank you so much.
Thank you. Thank you for inviting me. I'm very happy to be here.